we're going to be demonstrating how to do a dry dressing change today. And so I'm going to be starting at the nurse's station. And so while I'm at the nurse's station, the first thing I'm going to do is I'm going to be pulling up my doctor's orders to see. And I've got Anna Taylor, and her date of birth is 4/24/1991, and she's not allergic to any kind of medications. Colon mass with a colon resection, and so I'm going to go down, and it says I'm going to do a sterile dry dressing change to the abdomen daily using 0.9% sodium chloride. So once I've checked my doctor's orders, I'm also going to be checking for the medical record, and in here we do know that they did have the colon mass, that they have the abdominal incision. And then we're going to look to see, is there any other kind of restrictions that we need to know about before we go in there and we do this. I'm also going to be looking at what kind of dressing change that they had, or what kind of dressing is on that, so I know what to go pull when I go to my supply room. So I've looked at that. I'm also going to be looking at, the policy and procedure. Sometimes if the doctor just orders a dry dressing change, the policy and procedure will tell me the type of solution, which is typically 0.9% sodium chloride. But in the orders, it does say that we're going to do a daily dressing change with a 0.9 sodium chloride. So I've checked my policy and procedures, reviewed the doctor's orders, looked in the chart to see if there was anything else in there. I'm also going to be looking at what the patient's learning needs are, because a lot of times they're going to go home with their dressing, and they're going to need to change it, or do they have a loved one or significant other that they can use to prepare that. So I've looked at that, any kind of restrictions, learning needs that they might need. I'm also going to be identifying the fact that we know that they're going to need wound care, and the doctor said daily. Sometimes it says PRN, so I would need to look to see what it's going to take. Is that dressing got a lot of drainage on it? Is that when I'm going to need to be changing that? And so also, while I'm going to be looking at skin integrity, the tape that's around securing that, what does that look like once we take it off? Is there any other kind of skin integrity issues that we need to look at? What kind of PPE do I need? Is the patient on any kind of type of isolation, or based on the type of dressing, do I need any specific PPE on? Maybe a shield, eyewear, or maybe even impervious gown over my uniform to help prevent it from having anything like that. I'm also going to be checking to, when I went into my patient's room prior to coming and checking my doctor's orders, when we did rounds, we were checking to see what my patient's pain level is. I checked to see if they've had this dressing change before, or is this the first one? Do they need pain medications? Do we need to teach them non-pharmacological pain techniques like taking deep breaths, or even some distraction? Or if they need pain medication, we've looked at the order to see what's ordered. Do they have PO? Do they have IV? If it's PO, we need to at least give it 20 to 30 minutes before we start the procedure, so that way they've got some pain medication on board. Okay, so the other thing that we're going to be doing, I've checked my orders, and I'm just going to make sure that we are looking at what kind of, and like I said, I've checked the chart to see what kind of dressing that we need, or the policy has told us that we're going to need. And so I need a biohazardous bag, I need a blue pad, which is an absorbent pad, and then I looked, we're going to need an ABD. So on these, I'm checking for expiration date. I'm checking to make sure they're all intact. I've got enough sterile gloves to make sure I can keep the procedure sterile, because the policy says to do, and the order said to do, a sterile dry dressing. So I'm going to need to know how many 4x4s I need. And then if I have any extras, the expiration dates on these, and are they intact. my paper tape, and I've got my 0.9% sodium chloride, and I'm looking at the expiration date, and it is within the expiration 3 of 2025, so we are still good with that. I do have some extra supplies here just in case I contaminated, and again, I'm checking for the intactness of those as well. And I'm gonna go ahead and just set those right over here. So once I have gathered all and I've checked to make sure that I have everything I need, and I also want to make sure that that I've got good lighting in there, so that I can see whatever we're doing. Okay, so I'm gonna go ahead and shut down my computer at the nurse's station, okay, for HIPAA. And once I do that, then I'm gonna go ahead and I've gone to the supply room, and I've gathered all of my supplies and stuff. And I'm gonna go ahead and go on to the patient's room, okay? So once I come into the patient's room, I'm gonna set my stuff down right here. And usually there's the hand cleanser on the wall. I'm gonna use that. I'm gonna use some of this hand cleanser right here. And while I'm doing this, I'm gonna go ahead and identify myself. Good morning, my name's Jan Bucks-Kemper. I'm a registered nurse. And the doctor has ordered a procedure, but before we start that, I'm gonna go ahead and raise the bed up. And if you could tell me your name, Anna Taylor, date of birth, and your date of birth, 4/24/1991, good. And now, do you have any allergies? You don't have any allergies. So no allergies to like paper tape or any kind of cleaning solutions? Okay. No drug allergies, but nothing to any specific non-drug related items. Okay. So I'm gonna get the bed at a good working height, and I'm just gonna check my computer real quick. Okay, and I pulled up my chart, Anna Taylor, date of birth 4/24/1991, and so I have the right patient here, okay? And so we are going to, with that, Ms. Taylor, the doctor has ordered us to do a dressing change on this abdominal wound that you have here. And so, can you tell me what your pain level is right now on the scale of 0 to 10, 0 being no pain, 10 being the most pain? So a 3. Okay, so that medicine that we gave you earlier, is that helping? Yes. Okay, so let me know during the procedure if you're hurting, and we'll make sure we note that so that we can plan for the next one, okay? Or maybe get you more if we need to. All right. So we'll be checking with you throughout the procedure with that. I'm gonna go ahead and make sure, like I said, good lighting. We're gonna provide for privacy, so I've got the door closed. And so I'm gonna go ahead and I'm gonna start getting you ready. So the first thing I'm gonna do is I'm just gonna make sure I've got all my supplies that I need here. I'm just gonna set those out. I'm gonna put this in here. My biohazardous. And since I've touched all of that stuff, I'm gonna go ahead and do another medical hand wash. So on the wall, they have the medical hand wash, and get that done. And then we're gonna go ahead and get you positioned and get you ready for this. Do you have any questions for me so far? So we're gonna be taking that dressing off and okay, so I'm going to be exposing you, but we're just going to expose what we need. We'll kind of keep you covered here. And then I'm going to pull your gown up, but I'm going to make sure that I've got it tucked in so that as we're cleaning, the gauze is not touching your gown or anything, okay? And even really before that, I need to go ahead and get blue pad put underneath you. And so if I needed to ask for any help, I could do that. So I'm gonna go ahead and cover you back here. So let's get your blue pad underneath you. So I'm gonna get you to bend your knee for me, okay? And I'm gonna roll to the side there. Make sure we don't get any wrinkles on there, okay? And then I need you to bend this knee for me, okay? We're gonna come this direction. Okay, while I was doing all that, getting that blue cover and everything underneath there, I was also checking to make sure, do you have any drains? Do you have any other thing, your skin integrity, making sure you keep yourself covered there, okay? So we want to make sure we're not pulling any drains out that we need to. Okay, so now that I've positioned, I don't want to take that dressing off with these gloves because I don't want to cross-contaminate potentially, so I'm going to go ahead and take these gloves, glove to glove, skin to skin, and I'm going to go ahead and do my medical hand wash. And like I said, we're going to be doing a dry dressing change on your abdomen, and what we're going to be using is 0.9% sodium chloride to do that. So I'm going to go ahead and do my medical hand wash, put another set of clean gloves on, because we don't want to cross-contaminate. So once I put these clean gloves on, I just want to be touching this area right here. Okay, well these gloves maybe I just need to be a little more careful. But sometimes that happens. Okay, all right, so I'm just going to be looking at the outside of the dressing just to see if I see any kind of drainage. I'm going to be looking to see the date, time, and initials, so I know when this dressing was changed before. I'm just fixing the tips of my deal, but this may be the first one, so if it's the first, it's not going to be on there if we just had surgery yesterday. So I'm just looking at all of that, and so I'm going to use what we call a push and pull. So as I'm going to push down on your abdomen as I kind of pull that tape around. So sometimes we can use, they have adhesive remover, so that helps loosen that tape if we needed to do that. Sometimes just an alcohol pad rubbing on there will kind of help loosen that if you're not having any problems with dry skin and alcohol. So once we've loosened that all up, we want to grab that and pull it straight up. And I'm going to be evaluating because we want to make sure we don't have any tape problems as that's coming up, the medical tape tearing the skin or anything. And so I'm going to check the dressing, look to see color, amount, odor, the consistency, because I need to note all of that so that I can chart that whenever we get through for my documentation. And if there's anything in here that I need to report to the physician, that was anything that was unusual about that. So once I've done that, I'm going to go ahead and close this, do my glove to glove, and do my skin to skin. And we're going to dispose of it per the policy, okay? So I took those gloves off, and I'm going to go ahead and do a medical hand wash. And at this point, I'm going to look at the incision. I'm going to look to see if the incision itself, is it approximated? Is it together? Is there any redness along the incision line, which sometimes it can be just a little bit pink. I note that there are staples, so I would look to see if there are staples, sutures, any other kind of drains around that. any other kind of closure devices. I'm going to go ahead and count. So I've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 staples. And I'm going to look at the surrounding tissue as well. Does it have any problems? I'm going to look at the tissue where the tape came off for the skin integrity. And it all looks really good at this point in time. Okay, so once we've done that, if I need to measure, because when I'm looking at the approximation, and you don't have to necessarily measure the length, but if it looked like it was open anywhere, do I need to measure? If it was open, I would use a measuring device to do that, okay? I'm also looking to see if there's a specific spot that may look like it's infected. And if it is, then we would need to contact a physician to maybe get a culture on that, and we'll do that after a while. But we're going to go ahead and get ready to clean that. So I think we've got everything. You've got my bottle bag here. We've loosened the adhesive on there, and now we're ready to go ahead and start setting up. So the way that I set up is the thing that you're going to be using the last is the furthest thing away. So you're not crossing over your items. So remember sterile technique, sterile to sterile, sterile over sterile, and so I'm going to go ahead and open up my ABD, and we've already checked all the sterility, the intactness, and all that kind of stuff. So I'm going to lay it right here, and I'm going to be setting up my table in a way that I'm not going to be turning my back on my sterile field. Okay, and so that's the last thing I'm going to use, so it's going to be the furthest thing away from me. And then of course with my 4x4s, you're going to open away so that you can make sure that the items stay sterile on the inside. I'm just going to move that back. Now you need to make sure that when you're touching here that you're just touching around this edge right here, because that part right there where it just came unsealed is not sterile. It's the inside that we want sterile. So I've got to make sure my thumb doesn't cross over into the sterile part of that, okay? So this is going to be my dry dressing, or the dry part. Again, I'm going to open this away so I can see the contents. Okay, again, making sure my thumb is not going over the edge of that. And so I have my normal saline here, 0.9% sodium chloride, and so I'm going to palm the label so that it doesn't get messed up. So I'm palm the label. I'm going to take my seal off, open it, and I'm going to go ahead and just lip a little bit. Now I want to pour from the same side that I lit. So you see me kind of moving over here, and I'm going to go straight in without my hands going over, and I'm going to pour my solution on there, okay? Step back. Now you saw me hold my lid up. I don't want to cross over the lid. You can set it down if that works for you. But if I set it down this way, it contaminates that contaminates the bottle. So I'm going to go ahead and put that back on. Then I'm going to take my pen and I'm going to date, time, and initial. So the date is the time that, I'm going to step back for just a second. Let me do a medical hand wash real quick. So I date, time, initial that. So I dated the date that I opened it, the time that I opened it, because the policy says that it's only good for 24 hours, okay? And so if this was a used bottle and I came in and it was already open, the seal had already been broken, and you can tell some's been out, then I would need to check that date, time, and initials to make sure that it's still within the 24 hours, okay? I've got my paper tape that I'm going to need. I'm going to go ahead and leave my pen out because I'm going to need that. So once that we've got that done, now I'm going to go ahead and start putting on my first pair of sterile gloves. So at this point, we've just used one sterile glove, okay? Now, do note that when I open this package, that the edge of that package is touching the 4x4, but this, or the ABD, that's the outside of the ABD, and so if it was touching on the inside of the ABD, we would need to get a new one. And so that's just something you need to evaluate when you're opening that. So it doesn't look like it's touching on the inside, it's just touching on the outside. But if we had any doubts, then you can always throw it out, okay? So I'm gonna go ahead and take this off. And I do have, and I'm stepping back so I don't turn my head, and I'm gonna get a new package of an ABD. Now, note I turned the bed so that I could open this, okay? And I'd already checked the expiration date on that and everything. So probably needed to evaluate that before I opened my ABDs, but when I was looking at it from this angle, I could tell that that was closed. So, like I said, in and out, throw it out, always open another one. We don't want to introduce an infection to our patient. Okay, so that we've got everything done there, and we've got our, and as you see, I've got my table turned because we want to be able to keep our sterile field in our view at all times. I kind of think of it as a wide angle camera right here. I've got my biohazardous bag right here because once I put my sterile gloves on, my hands have to stay in my box, okay, as I'm doing that, okay? So, move that over a little bit. I'm just gonna move this in just a little bit, make sure we're being seen. And I'm just crinkling that back right there. I can tell my gloves are inside that fold. So I got my finger underneath there so that hopefully that'll keep it from, and then just reaching underneath this flap right here. And then opening up my sterile gloves. Now I want to make sure the package doesn't fall back on itself, because if it does, then it's considered contaminated, and I would just need to open a new pair there. So just to make sure, I'm going to go ahead and, if I'd already done one, making sure I'm not turning my back on my sterile field. But I've just opened up sterile supplies, and I got a lot of that on there this time, so I'm gonna have to rub it in there till it dries. Okay. Okay, so I've got to make sure, so the glove should be with the thumbs pointing out, and so this is your right hand, this is your left hand. So I'm going to go in, I can touch right here because I'm within that 1-inch border, but I'm away from there. So I'm going to touch the very edge of that glove, pick it straight up, pull it back, making sure I'm not crossing over that one. And with this one, this is the part of the glove that's going to be touching my hand. So it's going to be the, and so I'm just going to work it. I'm going to spread my fingers, okay? And then I'm going to get my thumb tucked up underneath there, and I'm going to work that glove up on my hand, okay? Once I let go, then we need, I don't ever want to go back to the cuff, okay? Now with this hand, this is sterile over sterile, sterile to sterile, so I'm going to pick, I'm using my thumb at this point, because I'm sterile to sterile, sterile over sterile, okay? So I can get my fingers up underneath the cuff, okay? Because underneath the cuff is the sterile part now. This is the part that's going to go back and next to my skin. So I've got my gloved thumb up. I'm going to work this in, okay? And again, once it does that, then I'm going to just go ahead and fix my gloves, because you want to make sure you have good fitting gloves. You don't want the gloves way past your fingertips, because then that can cause you to have some contaminate your gloves or contaminate the wound. Okay, so I'm going to put my fingers together. I'm going to just check for integrity. I'm going to leave that package alone. Now, if I were going to do a culture, after I clean and dry, you do your culture, I could just lay it there on that till I get done. So now I'm going to go ahead. This is my cleaning. I need to make sure that I don't touch the outside as I go in, so I'm going to get one, making sure that the other ones don't touch. I'm going to squeeze any excess out. I'm going to transfer without touching, and with this one we're going to go down the center. So the first one is going to go down the wound, okay? So we don't start way out here, because then we're dragging bacteria. So I'm going to start at the point of the incision and work my way down, okay? Step back with my hand still above my waist. I'm going to go ahead and dispose of that one, and I'm going to go ahead and get my second one. Transfer without touching. Now, without crossing over, because my glove is over the wound, I'm going to go to, which is right outside the first 1 inch. Again, right at that, and I'm going to go down. And yes, you may feel it bump because it's going across those sutures on the first and the second. And again, I step back without my hand dropping. Transfer without touching. Now I'm going to do this first inch on this side. Okay? Now the whole time is I've got to make sure that this hand is not touching anything but the inside of this, and that this hand is not coming in contact with the gown or anything else like that. So transfer without touching. Now I'm going to do the next 2 inch, so I'm just going to be just a little bit, but you can see my arm is not going over the incision or where I've cleaned, just the glove part. Squeezing any excess out, transfer without touching, and now we're going to go out here. Now, if I had a lot of drainage and I needed more, I can continue to go out. You'll always start middle and go out, 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 just until I get all the other drainage off. So we've got it clean. Now we need to dry it. So we're going to dry it in the same way we did. Okay, I'm going to pick up a 4x4. I'm going to transfer, and I picked up 2, which is fine because I just need 1, 2, 3, 4, 5, 4x4, 6, 7 to put on there. So I'm going to go ahead and start at the incision side, work my way down, okay? Making sure you keep your hands in your box, okay, not dropping down. Again, transfer without touching. Go that far side, that first inch, drop. Get my next 4x4. Transfer without touching. I'm going to do the first inch over here. My next one. Transfer without touching. I'm going to go to that second 2 inch right past that, making sure that I'm not crossing the incision, but just with my glove. Transfer without touching, and we're going to go down this one right here. Okay. Now that I've cleaned and dried, if the order had asked for a culture, this is when we would get the culture, whether aerobic or anaerobic. We would get the culture now. And let's say that when we were looking at it, there was a little red spot up here. That's where we would want to do the culture, and then we would get the culture. But there wasn't an order at this point for a culture. But as the person that's doing this, if I saw that, I'm going to report that so the doctor can order to get a culture if that's the case. Okay, so I'm going to go ahead and get my 4x4. So we finished cleaning. I'm not going to go back to the wound with this hand. So I'm going to use this hand right here. And I'm gonna step back so I'm not turning my back on any of my sterile supplies. And I'm gonna make sure I cover the wound. Where it lays, it stays, okay? I don't wanna be moving that around because I don't want it moving around and bringing bacteria to, even though I've cleaned it, we don't wanna bring bacteria into that. So I'm gonna use as many as I need to, okay? Once I've done that, and of course I'm putting the dressing on that the physician ordered. This is what came off of it, so I'm redoing what. But we would go with whatever the doctor orders. Doctors have different dressings they like. I'm done with this, so now I can cross over it. So I'm gonna go ahead and pick this up. Just touching, so you see the blue line. The blue line is the outer portion of the ABD. And so I need to make sure, so I'm actually kind of finished with all of this at this moment, okay? And so I'm gonna go ahead and place it so that all of the 4x4 is covered. I don't want any 4x4 sticking out because then you can have the wicking, okay? If it gets moisture here, it'll go underneath there. If for some chance you don't want to move it around, I just may need to give another ABD to put over there so I've got all the 4x4s covered. So all the 4x4s are covered, so at this point I'm going to go ahead and glove to glove, skin to skin. Because I took gloves off, I'm going to go ahead and do a medical hand wash. Not getting quite as much as I did the last time. I'm going to put another pair of clean gloves on. Okay, I'm going to get my paper tape and we are going to tape it in a picture frame. And again, I had verified at the beginning if my patient was allergic to any kind of tape. Paper tape typically is the tape that most people are not have a problem with. And so we're going to picture frame it. Okay, and with this last piece, about a 2-inch piece or whatever you got here, we're going to put our date. The date, the time, and the initials. And we're going to put that right there, so that the next person knows when we did that. And so I'm going to go ahead and remove all of this. Get that patient covered up. These gloves are clean. I just touched the outside here. So get my patient cleaned up. And we're going to go ahead and remove that blue pad. And possibly, so these were just touch the outside, so it's not contaminating anything. And I'm going to go ahead and turn, and if we needed to have help, and let me get this out of the way. Bend that knee, okay? And I would need to put a fresh one underneath there if we needed to, making sure all the drains. Now, how did you tolerate that through the procedure? Was the pain medication that we gave you enough? Okay, and glove to glove, skin to skin, do a medical hand wash. Okay, we are done with that. How do you feel like you were able to tolerate that? Okay, did you have any pain during this? Do we need to change what we do as far as pain medications, were you good throughout that, so you tolerated it without any major discomfort? Okay. And so I'm going to go ahead and make sure I get your bedside table here. I'm gonna leave this in the patient's room in case they need to do it tomorrow. Step back and put it over here on there. So I've got the bed in the lowest position, the side rail's up ×2, the wheels are locked. I've made sure the patient is comfortable, got their deal here, and if they are not MPO, get whatever they need or drink or whatever here. So are you doing okay? Okay, I'm gonna step over here to the computer. And again, I'm gonna wash my hands. Pull up the computer. And I need to document okay, so we're going to be in the nurse's notes. Sometimes in the nurse's notes there's a place that you click for documenting the wound. And so the main thing that we want to do is we want to make sure that I need to report, so I identified how the patient tolerated the procedure, what their pain level, so what's your pain level afterwards, so on a scale of 0 to 10, 0 being no pain, 10 being the worst pain, what would you say your pain is? So it's still out of 3. Okay, well that's good. And during the procedure I was watching to make sure the patient wasn't squinting or were they grimacing while we were doing the procedure, and they didn't do any of that, okay? And so we're going to make sure that we're documenting. I'm looking for, was there anything I need to let the doctor know? So we talked about if I saw that there was a lot of drainage, or that there was, maybe the drainage was foul smelling, or the incision had a red spot, then we would need to make sure that we let the doctor know about that. We're going to be documenting the location, which was the abdomen. We're going to document that we removed the old dressing, what that dressing looked like. Was there, what kind of the odor amount, consistency, and what kind of drainage that there was. We're going to make sure we look at the skin integrity around it to make sure that the paper tape wasn't doing that. Then we're going to talk about how we did, what kind of solution that we used. We used the normal saline to do that. We're going to look at how many sutures, or actually staples, so how many staples there were, what the skin integrity, was the incision approximated, or was it coming apart? So what the dressing looked like, what the dressing had on it, what the incision looked like, if we had to measure, what were our measurements on there, if we did the width and the length, and then the sutures or whatever was there, and then we were going to be looking at what we did. So we did use sterile dressing change, we used normal saline, we did 4x4s and two 4x4s and an ABD, so that way the nurses know what was used before, so they know kind of an idea of what they need to be pulled for that. And then we talked about reassessing the pain, and just making sure, so I'm typing in and I'm documenting that the pain tolerated without any complaints, okay? You need to have something that is descriptive with that. And so once we've done that, now we're going to go ahead and shut down our computer. We need to make sure bed's lowest position, side rails up ×2, wheels are locked. We've got this, and as I'm leaving, any extra stuff is gonna stay in the room for the next, and I'm gonna do my medical hand wash as I'm walking out the room. Okay, and if you need anything, just make sure you press your call light if you need anything from us, okay? All right, well, thank you, and I'm gonna go ahead and go report any abnormals that we did. Okay, thank you. Washing my hands as I leave the room.